bottom line is, anywhere you're stimulating new formation of tissue, anywhere you're trying to make tissue live in a new address, anywhere you want to increase blood flow to the new tissue, platelet-rich plasma has a role. Hello and welcome to this edition of the Wise Medical Minute. Today I want to talk about PRP. Not just any specific indication, but PRP in general. Platelet-rich plasma has been used for many different purposes, but the common denominator for any of the things that you're using PRP for is you're trying to stimulate or augment a healing process. Now, we've talked about PRP in previous recordings in the context of our autologous fat transfer procedures. And when we transfer fat from the belly to the breast, or the belly to the butt, or the belly to the face, you can do belly to the hands, or from wherever you don't want it to where you do want it. PRP enhances the survival of the fat that's being transferred. So that's our most common use. But equally important and equally common in other circles is for conditions like facial rejuvenation, people who have the natural effects of aging, the wrinkling of the skin, the different things we do with hyaluronic acid procedures, or I should say hyaluronic acid products. Those products, when used, the effects are augmented when concurrently PRP is used. For wrinkling and just thinning of the skin, PRP can be used to thicken and rejuvenate the skin. And we talk about that in the context of hair restoration. You're trying to stimulate a hair growth process. PRP is useful in that regard. We have a lot of experience in recent years with various musculoskeletal indications. When people have issues with joints or tendons, and the orthopedic surgeons are really almost pioneers in this regard. They've been using it more so than other specialties for enhancing the healing process for a lot of different musculoskeletal injuries or chronic conditions. So PRP basically, in terms that I prefer to use, works like Miracle-Gro for flesh. Now, that's what I've been quoted as saying in many different places, but I prefer to correct myself and say it's really Miracle-Gro for anything that's healing. And it works by virtue of its components that are mostly growth factors. Now, we know of platelets for their role in clotting. Everybody thinks of platelets as being what migrates to an injury when we cut ourselves, and those platelets not only stimulate hemostasis or clotting, those platelets also initiate a healing process. So once that was recognized, someone got the bright idea to concentrate these platelets and then put more of them in whatever place you're trying to stimulate a healing process. Now, this is accomplished by first drawing your own blood. You take the blood, and obviously if you're ending up with plasma, by definition you have to do something to keep it from clotting. So you put something in your tube to keep it from clotting, turn it into plasma, and separate out the red cells and the white cells that you don't want. Then you further spin it down, and in the process of centrifuging the plasma, there's a section of the resulting spin that's platelet poor, and we sometimes use that, sometimes we discard it. And then there's a section of the spun tube that's platelet rich. So depending on the technology, we use two different technologies, and I don't get paid by either one of them, but depending on the purpose, we have a product known as the Region Labs version. And for when I really want a larger volume of PRP, or for when I want a higher concentration, we use the harvest system. And there are 2 or 3 others out there, but that kind of gives you the spectrum of brand names that have been used, and everybody and their mama came up with a new tube that can be used in any old centrifuge. But those have been standardized, and we like to match the type PRP for the different indications. Now, just so I can say that we mentioned them, there are at least 8 different kinds of growth factors, and the names are kind of fun to throw at you, and the letters are even more boring. But the bottom line is, the reasons why it works like fertilizer for plants, but for human flesh, is because of these epidermal growth factors or transforming growth factors. The vascular endothelial growth factor, I think, really is a significant one, because when we put fat in a new location, it's got to develop a blood supply. So I think the presence of the formation of new blood vessels to the fat that we've transferred is a critical role for the PRP. Now, when we're doing facial rejuvenation, fibroblasts are involved in making new collagen. So the fibroblast growth factor is one of the things that's contained in the PRP. And other growth factors are derived from PRP, and I won't bore you with all of them, but suffice it to say, there's new collagen formation by fibroblasts, so you need to stimulate the formation of these colonies of fibroblasts. The result of that is new collagen, so anything that's healing, you gotta have new collagen. The idea there is for creating new tissue in areas where the tissue was aged or old. Now, people have gotten real creative with the use of PRP, and I'll give you the example without using some trademarked brand names. But Platelet Rich Plasma is a very useful component of the treatment of what I'll call intimacy rejuvenation. Okay, you've heard fancy names like the P shot and the O shot and the G shot and all those things. Those are trademark names that I don't use, but in case we have to hashtag something, I'll use those names because that's what's more popular. But stimulating the growth of new tissue in areas of intimacy, and this is as true for the male as it is for the female. Stimulation of formation of new blood vessels. You can imagine where increasing good blood flow is important. All of these things are places where PRP in different amounts, different doses, different applications can be useful. Now, we've been most gratified in our use for breast augmentation. And in some circles, they use hyaluronic acid as a component of the breast augmentation along with the PRP. My strong preference is to use your own fat. Longevity is much greater with your own fat, and we've had a lot of fun. I refer you to our video on breast augmentation for further details. But bottom line is, anywhere you're stimulating new formation of tissue, anywhere you're trying to make tissue live in a new address, anywhere you want to increase blood flow to the new tissue, platelet-rich plasma has a role. Now, the controversies that surround PRP are derived from the fact that people try to equate it with so-called stem cell therapy, and that's a misnomer. There are stem cells in fat, and when you use PRP, it does recruit stem cells from the bloodstream to wherever you put the PRP. So that's not exactly dishonest, but calling it stem cell therapy is what got some of the charlatans out of business and made it difficult for everybody else when the FDA came down on them for calling it stem cell therapy. So yes, stem cells are recruited by the presence of these growth factors that are contained in the PRP. That's an honest statement. Okay, similarly, when we remove abdominal fat, stem cells are more plentiful there, even than in the traditional sources like umbilical cord blood or bone marrow, or certainly more than in regular blood that's drawn in a traditional venipuncture. So when you have a source for stem cells like fat or like they use Wharton's jelly more often now. And you combine it with PRP. You get the combined benefits of the so-called stem cells. But I don't want to confuse things by getting too much on that plane, and I'll suffice it to say that I believe and I think we can demonstrate with data that PRP does recruit the presence of stem cells, and stem cells are cells that can become other forms of tissue. My evidence for that is based on people who we did fat transfers years ago. When they come in for their annual exams, we like to do mammograms every year on people who've had a fat transfer to the breast. I have fun because the radiologist can't tell we put that fat there. And the beauty is, the fat is not just fat anymore. I honestly believe it becomes normal breast tissue, because radiologists are pretty smart. And if it was not normal breast tissue, they would know it. And the mere fact that a year later, after a fat transfer, they can't tell if fat's been transferred, tells me that there's been some transformation of that fat into whatever tissue is normally present in the breast. And we've even had examples of where pathology that occurred previously, i.e. fibrocystic disease, occurred in the area where we transferred fat. So it behaves, it looks, it feels, it responds like normal breast tissue. So I think the day will come when implants will become passé. But some people want headlights that point to the ceiling. And that's not what you're going to get when you do a breast augmentation with PRP or a fat transfer. But if you want to restore perkiness and the normal volume like what was there once before, before children, before weight gain, before weight loss, you can restore what was once normal realistically and you can augment what was never there with PRP and fat. But I don't like to try to use words like lift or other things that I've seen people use when they talk about PRP breast. Lift is just a misnomer. Anyway, I'll conclude it there, and I'll invite your questions about platelet rich plasma or any of our other aesthetic or cosmetic procedures, or any questions you have whatsoever by emailing me at info@wisemedicalcenter.com. Thank you.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.